Causes and supplements for thrombocytopenia. There are several potential causes for thrombocytopenia or low platelet counts. These causes are generally divided into decreased platelet production, increased platelet destruction, and platelet retention. Each category has a variety of potential factors that may affect platelet levels in different ways. Decreased platelet production. Platelets are produced in the bone marrow, and any condition that affects the bone marrow's ability to produce platelets can cause thrombocytopenia. Some common causes in this category include disorders such as leukemia, myelodysplastic syndrome, and aplastic anemia can directly affect bone marrow function and reduce platelet production. Low levels of vitamin B12, folate, or iron can impair the bone marrow's ability to produce platelets, leading to low platelet counts. Certain viruses, including hepatitis C virus, HIV, and Epstein-Barr virus, can infiltrate bone marrow cells or trigger an immune response that disrupts platelet production. Increased platelet destruction. When platelets are destroyed faster than they are produced, platelet counts drop. This rapid destruction can be due to immune or non-immune mechanisms. Autoimmune diseases. Diseases such as immune thrombocytopenic purpura, lupus, and rheumatoid arthritis can cause the immune system to mistakenly attack and destroy platelets. Certain medications, including heparin, quinine, sulfonamide antibiotics, and some anti-seizure medications, can trigger an immune response that leads to platelet destruction. This is called drug-induced thrombocytopenia. Certain infections, especially sepsis, can lead to platelet destruction as the body responds to inflammation and infection. Platelet retention. The spleen is an organ that filters the blood and plays a role in immune function. When the spleen is enlarged or overactive, it traps or retains large numbers of platelets, which reduces the number of available platelets in circulation. Disorders such as cirrhosis can cause the spleen to enlarge, which can cause more platelets to be sequestered and result in a low platelet count. Certain cancers can cause the spleen to enlarge, which can lead to platelet retention. Other chronic conditions. Conditions such as kidney disease or chronic inflammation may also lead to a low platelet count. Dietary tips for treating thrombocytopenia. Thrombocytopenia is a condition in which there is an abnormally low platelet count, which can lead to blood clotting problems and may cause excessive bruising, prolonged bleeding, and other complications. Platelets play a key role in the clotting process, and a lack of them can have serious health consequences. For people with thrombocytopenia, a strategic dietary approach can support platelet production and overall blood health. Here are some dietary considerations that may help improve platelet count and function. Dark green vegetables are nutrient-dense foods that contain a variety of vitamins and minerals that can benefit people with thrombocytopenia, especially vitamin K. The vitamin K is essential in the body's natural clotting process and plays a role in forming blood proteins involved in clotting. By eating leafy greens regularly, people can support the body's ability to form blood clots, an essential function when platelet counts are low. Here are some leafy greens worth mentioning. Spinach is known for being rich in vitamin K and can be added to salads or sautéed as a side dish. Kale is rich in vitamin C and vitamin K, which help boost immunity while also aiding blood clotting. Not only is kale high in vitamin K, it also contains folate and calcium, which can support bone and blood health. Vitamin B12 is essential for the production of red blood cells and platelets. Vitamin B12 deficiency can lead to a variety of blood problems, including thrombocytopenia, as it may slow the rate at which the bone marrow produces new cells. People with low vitamin B12 levels are at a higher risk for anemia and other blood disorders, which may exacerbate symptoms associated with low platelet counts. Good sources of vitamin B12 include: eggs are an easy and versatile source of vitamin B12 that can be boiled, fried, or baked. Milk, cheese, and yogurt are natural sources of vitamin B12 that can be easily incorporated into everyday meals. Foods such as salmon, tuna, beef, and chicken provide vitamin B12 in a bioavailable form that the body can use effectively. For vegetarians or vegans, grains fortified with vitamin B12 are plant-based alternatives to animal products. Folic acid, also known as vitamin B9, is essential for the production of new cells in the body, including platelets. A folate deficiency can directly affect blood cell production and may worsen thrombocytopenia. Ensuring adequate folate intake helps support the body's ability to regenerate healthy blood cells and prevent further platelet depletion. Here are some excellent sources of folate. Oranges, grapefruits, and lemons are particularly high in folate and can be easily incorporated into your daily diet. Beans and lentils. Not only are these legumes high in folate, they also provide fiber and protein, which can stabilize energy levels. Avocados are an excellent plant-based source of folate, healthy fats, and vitamin E, which can help reduce oxidative stress in the body. Iron-rich foods. Iron plays an important role in the production of hemoglobin, which is required for oxygen transport in red blood cells. With thrombocytopenia, iron helps maintain overall blood health, which is essential for patients with low platelet counts. Iron-rich foods fall into two categories: heme iron, found in animal products, and non-heme iron, found in plant foods. Beef, turkey, and chicken are excellent sources of heme iron, which is easily absorbed by the body. For vegetarians and vegans, tofu and tempeh provide plant-based iron and protein. Many cereals and grains are fortified with iron and can be a helpful addition to breakfast.